So this is sort of talking about, I'll let you go into this, Jacob, about, I think cost is a big question for a lot of these patients, about, next generation sequencing and how is the cost covered exactly, or is it covered exactly?
Yeah, I think this is kind of the big push, and everybody wants to have more information, and knowledge is power, and I think the Centers for Medicare and Medicaid Services, took heed of this and realized how important next generation sequencing is in somebody's cancer journey, right? So about almost 6 years ago, they put out a statement saying that every patient with advanced metastatic cancer should get some type of next generation sequencing, and that they would cover and make sure that there's access so that patients can get that. And I think that was a major point in oncology and in science and in medicine, when this large governing insurance body said that patients should be able to have personalized cancer therapy and personalized cancer informing their care. This was a massive effort, and I think it's only done wonders for patients to be able to have access to these type of tests. So any patient should be able to get next generation sequencing through one of those vendors that we had mentioned earlier, at little to no cost, or covered completely through their insurance.
Perfect. So I think, really talking about the take home points, for this presentation, I think for patients, I think it's always important that you ask your doctor about next generation sequencing and if there is a role for your stage of your cancer and your type of cancer. It will be different for every stage and every type of cancer. Ask about the platform that they're using. We had mentioned some platforms here that are probably the more commonly used ones, but ask them about the platform they're using, as there's some differences between them. Ask about the cost with your insurance, as well as sort of Jacob touched with, regarding CMS covering a lot of these costs. And then, not all cancers, need the next generation sequencing testing, like we talked about with germline testing. Only really, folks that, may have family histories that may put them at higher risk of cancer, are some that we may consider germline testing for. Not all stage one lung cancers or other different types of lower stage cancers may need next generation sequencing for them. So talk to your doctor about, whether or not, these tests are needed or not. For patients, I would always say, always get a copy of your next generation report for your own records to be able to look for those clinical trials like I discussed, and to see if there's any new treatments potentially that may come, while, you or your loved one is getting treatment potentially. And then really, the last thing is, again, sort of talking really about your family history and really bringing that to the attention of your oncologist, because I think that's really important to sort of drive whether or not we do additional next generation sequencing testing with the germline and heritable testing or not. So I think these are sort of a few things that we talk about. So thank you again. We appreciate everyone's time. Jacob, thank you again for your time. We appreciate all your expertise.